Welcome back to Rohrich Knows Podcast, helping you become a better you. I want to thank all of my viewers. It's been an incredible experience in talking to all of you on my podcast as well as my YouTube channel. The response has been amazing, and I appreciate all of your hard work and input and your positive comments. I really appreciate that. And anytime you have any questions, just feel free to DM me or contact me anytime. So let's talk about tear trough fillers. They've been very hot in the media lately, and also how to treat them and exactly how not to treat them. And I think we've seen a lot of different stars that have had tear trough fillers, and then some that have not. And the most important thing is when you look at somebody's eyes, that's their key to their soul. So you can see, like Renee Zellweger here, she's had a blepharoplasty and it really transformed her. Even though the result looks good, it made her look different. And the key with plastic surgery is you don't want to make people look different. You want to make them look youthful and a better you. And I think that's what you want to do. So, and always remember that the eyelids and the cheek, a youthful sign is fullness. It's a fullness in your cheeks and your eyelids, so that when you lose fat as we age, what happens is that we lose that fullness. And you can see here that you really get that sagging, the bags in your eyes, and then you get things like filler fatigue. And it doesn't look good. It's just overdone, and you can see that with Jennifer Aniston and you know, the Kardashians. You know, they just have had too much filler. I know that Kim said she hasn't had anything done except Botox, but I'll let you decide on what she's really had done. And I think that the filler fatigue, you know, you can see that in Kylie Jenner. You can see that as she ages, you know, she's gotten excess filler in these areas, and you get that actually V deformity in there that makes you look even older. So you got to know when to hold them and when to fold them in fillers, and especially around the tear trough. In fact, a tear trough filler should only be done in very, very small indications, and I'm going to share with you the secrets of when it's good and when it's not. So you can see this in Jennifer Aniston. And she's beautiful, but you know, she had a little bit too much filler, it looks like. I'm not her plastic surgeon or her injector, but I can just see that it looks a little bit too much. And I think that's really the problem. And the problem with that is that, you know, you really, really make somebody look more aged. So I really think there's some key principles here for tear trough fillers, if you're going to use them. There are very few specific indications, and you have to know how to address the sequelae if you do it. And then there's some long-term problems with lymphatic obstruction, and if you're doing it, less is more. And other options are superior, and I'm going to share with you some of those other options which are far better. So these are really the best indications for a tear trough filler, like this woman that's in the bottom of the slide saying, it's youthful, excellent skin tone, no wrinkles, no skin laxity, no skin bulging, no eyelid fat bulging, and only a partial tear trough. And I think that's what you want. And somebody that has more than a type 1, a type 2, or a type 3, you really shouldn't consider them for fillers. They need something like fat, PRF, or surgery, especially a type 3. So in this patient, she just had a slight amount of fillers in the medial tear trough area, and that was fine. And I think that's really what you want to do. You want to just slightly improve that area and just make it look soft and not like nothing's been done, because the sequelae of botched tear trough fillers are significant, as these are all patients off of the internet. You can see there's lumpiness, there's irregularities, and the problem here is that it's hard to fix. It's very hard to fix. And even though you can melt it, it's hard to fix. So this is certainly somebody that would not be an indication for a tear trough filler. She's got redundant skin, full tear trough. that is not the indication for a tear trough filler, because the long-term sequelae of these are significant. Granulomas, induration, lymphatic drainage problems, all these things which really are hard to fix. And there's been some data to show that there's cheek or malar edema that is caused by lymphatic obstruction in these areas. And I think that's the big thing, is you can have a lymphatic obstruction, and you can't correct that by just melting it with using hyaluronidase, which can melt hyaluronic acid fillers. But the key thing we learned about hyaluronic acid fillers is that they don't always resorb, and hyaluronidase isn't always the solution for this. So that's the key thing. So what are some other options? And I think the other options are really threefold. There's PRP, PRF, and then fractionated fat with eyelid surgery. So let's break it down. Let's break it down into what's PRF, platelet-rich plasma, and platelet-rich fibrin. So what is one and what's the other? Well, both use growth factors found in your blood to stimulate cell regeneration and collagen production. And PRF, platelet-rich fibrin, is considered more advanced because it's a better choice for deep wrinkles and other signs of aging. And it does require multiple treatments. PRP requires 3 to 4, spaced a month apart. PRF requires 2 to 3, spaced 4 to 6 weeks apart. So those are key things. They're using your own growth factors, and it really softens the area around the tear trough and makes it look homogeneous, and it uses your own growth factors and stimulates collagen. That's what works good, and that's why it works better. So that's the better way to do it. And here's some examples, again, off Google: PRF versus PRP versus PRF. And basically, PRF gives you a little more subtle and I think more substantive result, especially in patients that have significant hyperpigmentation and tear troughs. And I think that's really, really the key area here. And what about surgery? When should you consider surgery? Well, the key element is you want to blend the eyelid-cheek junction. And how do you do that? Well, it's a 5-step technique where you really are reshaping the lower eyelid and blending it with the eyelid-cheek junction. And we've shown that time and time again in patients like this, where you basically have really a significant tear trough in this area, and then you do a 5-step technique where you're removing the fat, blending it, shaping it, removing the skin, and giving you a very nice youthful appearance. This patient had that procedure along with a face and neck lift to give you a nice eyelid cheek junction along with her lower face and neck lift. And that is the beauty of doing surgery to restore a youthful and balanced orbit. And that gives you someone who looks 10 years younger. Now, granted, she also had her lower face and neck done as well. But that's the key, is you want to blend the eyelid cheek junction, and this is done with fractionated fat. And here's another example: a younger patient but had some tear trough deformity and had the fractionated fat in that area to blend the eyelid cheek junction. Another more significant case with a significant tear trough bilaterally, again, eyelid surgery with blending the eyelid cheek junction and a lower face and neck lift. You can see a close-up view of that. That looks fantastic. And it looks youthful and not overdone, like you've seen before. Here's a more extreme case of a patient that had significant redundant skin and redundant fat, and we blended the eyelid cheek area, and she looks really dramatically improved and more youthful. So how do you decide between a filler or surgery? Well, this case is an example of that. The filler are patients that just are youthful, have good skin tone, don't have redundant skin or fat. Fillers work great here. Surgery, on the other hand, is indicated in patients like this that have dramatic bulging, thin skin, wrinkle skin, and that's the difference. That's the decision maker. And really, the key is you have to go and see a board-certified plastic surgeon, oculoplastic surgeon, or a facial plastic surgeon that is a true expert in aging, especially in eyelid surgery, because the eyelids are the key to the soul. So you have to know before you go and find a true expert that will guide you to doing a filler, fat, surgery, or a combination of all of these, or PRP or PRF. That's how you get the best result, because it's not the filler that's the important thing. It's who's doing the filler, who's doing the surgery that gets you into that right arena. So in summary, tear trough fillers today are not a quick fix. In fact, they can be a long-lasting bad fix. So less is more. Indications are very narrow, as I mentioned. And if it's an expert injector, they have to inject it below the orbital malar retaining ligament here, and they have to blend, not overfill. And by all means, use a non-hydrophilic filler like Restylane, which is a very good, stable filler, and it doesn't absorb water like a lot of others. So I think all that is, again, made by your surgeon or your injector, and I cannot overemphasize that. So please give me your comments, leave me your comments about what you thought of this, and hopefully this will help guide you when you're looking in the mirror in the morning and you're seeing the beginning of a tear trough. And please don't race to your local spa or your local injector without being fully informed with the information I just presented here. So thank you again very much, and we'll look forward to seeing you next time on Rohrich Knows.